morning. I hereby call this meeting of the House Democratic Steering and Policy Committee to order. I'm Debbie Wasserman Schultz, co-chair of the Steering and Policy Committee. Last fall, our committee held a hearing on Project 2025 that zeroed in on how Republican policies threaten millions of Americans' health care. Of course, Donald Trump and Republicans disavowed Project 2025 and promised to love and cherish, their words, Medicaid, Medicare, and Social Security. They lied. To all of us. The Republican budget that Trump endorsed and all but one House Republican voted for marks the largest Medicaid cut ever. 4 million Floridians, including 1.6 million children, risk losing care. Today we'll explore what Republican Medicaid cuts would mean for everyday Americans who count on Medicaid to stay healthy. We'll hear from an expert witness about the devastating impact Republican Medicaid cuts will have on kids, families, and seniors, and how it will cripple rural hospitals and entire local communities and economies. We'll hear from people who know firsthand the life-saving impact Medicaid has had for them, their children, and their families. And we'll expose the real reason Trump and Republicans want to gut Medicaid, to pay for tax breaks for billionaire donors like Elon Musk. House Democrats are united against this scheme. Together with Leader Hakeem Jeffries, Democrats stood united against the Republican budget, and Democrats will keep fighting together to save Medicaid and protect Americans' health care. And now I'd like to yield to Leader Jeffries for his opening statement. Thank you.
Good morning. Let me first thank Co-Chair Debbie Wasserman Schultz for her leadership, along with Co-Chairs Robin Kelly and Nanette Barragan for convening this incredibly important hearing. Let me also thank the witnesses who are going to be present here today and presenting for your participation, for your courage, your strength, your insight, and your wisdom. Secretary Cody Kinsley, Chris Dunham, Christina Otero, as well as Nancy Hagans, who happens to be from Brooklyn. President Trump promised on day one that he would lower the high cost of living in the United States of America. They have failed to keep that promise. Costs aren't going down, they are going up. Inflation is going up, and not a single thing has been done to drive down the high cost of living in the United States of America. Not one executive order, not one administrative action, not a single bill has been introduced, let alone presented on the House floor and passed to address the affordability crisis in the United States of America. Under Donald Trump and House Republicans, the economy is tanking in real time. At the same moment, House Republicans have introduced a reckless budget that would set in motion the largest cut to Medicaid in American history. It will devastate children, devastate families, devastate people with disabilities, devastate older Americans, result in the closing of hospitals and the shutting down of nursing homes. And all of this is being done to pay for massive tax cuts for their billionaire donors like Elon Musk. It's unacceptable, it's unconscionable, and it's un-American. And House Democrats are committed to doing everything we can to stop it. And we're committed to continuing to shine a light on these challenges for the American people, which is why this hearing is so important. We will at all times defend Medicaid, defend Medicare, defend Social Security, defend nutritional assistance to our children and families, and defend veterans' benefits. We're going to stand on the side of the American people, while Republicans stand on the side of their billionaire donors. And so we thank the witnesses for their presence here today, and I thank the members of the House Democratic Caucus who are going to continue to protect the American people. It's now my honor to yield to the once and future chairman of the Energy and Commerce Committee, Frank Pallone.
Thank you to our Democratic leader. Thank you for all that you're doing, Hakeem, to bring to light the devastating Medicaid cuts on the part of the Republicans, and I want to thank Debbie and the other co-chairs of the Steering and Policy Committee for having this very important hearing today. The House Republican plans to cut around $1 trillion or more from Medicaid would be the largest health care cut in history. All so they can give back a giant tax break to billionaires and big corporations. Now, Republicans understand that the cuts of this magnitude are not popular with the American people. And that's why they're twisting themselves in knots, repeatedly lying about the size of the cuts and their impacts. They claim these massive cuts can somehow happen without anyone getting hurt. And as the ranking member of the Energy and Commerce Committee, the committee with jurisdiction over Medicaid, let me set the record straight. First, the committee is being directed to find at least $880 billion in cuts. The only place the committee can find that kind of money is Americans' health care. Second, there is simply no way to cut hundreds of billions of dollars in federal Medicaid funds without taking health care away from millions of Americans. And if you doubt me, myself and Congressman Boyle, ranking member of the Budget Committee, received a response letter from the CBO yesterday. In that letter, they said, or they made clear, that almost all of this $880 billion plus of this money in our committee would have to come from Medicaid. There is no way around it. But yet Republicans falsely claim that they're just targeting so-called waste, fraud, and abuse. But we know the truth is the Republicans will call anything waste, fraud, and abuse just to justify taking people's health care. And the reality is that states cannot absorb hundreds of billions of dollars in Medicaid cuts in whatever form they take. At the end of the day, states are basically left with three options to address their holes in the budget. One, they cut people off Medicaid. Two, they cut the people's benefits. Or three, they cut payment rates to providers, knowing it will close hospitals, nursing homes, and community health centers. Now, the House Republicans' Medicaid cuts are like life or death to so many Americans in every one of our congressional districts. But I want to highlight the person that I brought yesterday to the, or I should say on Tuesday, to the joint address by the president. At Tuesday's night's joint address, I invited Lauren Zalepka from my district to join me. Lauren's daughter, Danny, has intellectual and developmental disability and relies on Medicaid for the care she needs. And that's this care that no other payer will cover, not Medicare, not private insurance. Just want to make that point. Lauren has dedicated her life to fighting for people with disabilities as a community leader and as a mother who knows exactly how devastating these cuts would be. And Lauren says that cuts to Medicaid would, and I'm quoting now, take away my daughter's life. Danny doesn't deserve that. As a longtime disability advocate, Lauren also knows that her daughter's circumstances are not unique. And I quote Lauren, without programs like Medicaid that help them get out of bed in the morning, they will literally be stuck or worse out in the community, unsafe and victimized. We cannot let these devastating cuts to Medicaid ever become a reality. Lauren and her daughter's Danny's story is powerful, and there are millions of other stories like that all over the nation. So after all, Medicaid is really a lifeline for these Americans. So now, if I can, Madam Chair, we have a video that I'd like to show.
House Republicans are cutting hundreds of billions of dollars in funding from Medicaid. These cuts will hurt all Americans. Medicaid covers 1 in 3 Americans, more than 40% of all births and 37 million kids, and more than 50% of seniors in nursing homes. These cuts will drive up healthcare costs for everyone and will force hospitals and nursing homes to close. Republicans are trying to gut Americans' health care to pay for giant tax breaks for the billionaires and big corporations, leaving millions of Americans hurting without health care. That's why we need to save Medicaid and protect Americans.
As we just saw, Madam Chair, I want to thank you and the Steering and Policy co-chairs for organizing this event. Thank you to Ranking Member Pallone as well. As we just saw, Medicaid ensures that our friends and neighbors in every corner of the country have access to affordable health care. Cuts to this program would have a ripple effect that impacts the entire healthcare system, driving up costs and preventing people from getting the health care that they need. The Republican budget takes an axe to Medicaid with nearly $1 trillion in cuts. And despite what Republicans claim, there is no way to make those cuts without hurting kids, parents, and seniors who count on Medicaid. Today, our first witness is Cody Kinsley. Mr. Kinsley served as the Secretary of Health and Human Services in the state of North Carolina. In that capacity, Secretary Kinsley oversaw North Carolina's Medicaid program, which covers more than 2 million people, including more than 40% of North Carolina's kids. Under Secretary Kinsley's leadership and alongside a Democratic governor and a Republican legislature, North Carolina expanded Medicaid to give health care to more than 600,000 people. Secretary Kinsley is a senior advisor currently with the Milken Institute, a fellow at the Aspen Institute's Civil Society Fellowship, and serves as an adjunct professor at the University of North Carolina, Chapel Hill. Before serving in state government in his home state of North Carolina, Secretary Kinsley served as the Assistant Secretary of the Treasury under Presidents Barack Obama and Donald Trump. Secretary Kinsley, you're now recognized. Thank you for being here.
Thank you. Co-chairs and members of the committee, in North Carolina, the Medicaid program now serves over 3 million individuals and has been instrumental in improving the health and residents while lowering the cost of care. Under the leadership of Governor Roy Cooper and now Governor Josh Stein, along with the North Carolina General Assembly, we've crafted bipartisan approaches to expanding access to care, investing in prevention, and controlling costs. In December of 2023, North Carolina expanded Medicaid, and in just over a year, more than 640,000 have enrolled. Many of these North Carolinians are farmers, fishers, firefighters, and child care providers. And now with health insurance, they can be healthier, take care of their families, and contribute meaningfully to our economy, especially in our vibrant small towns, as a disproportionate number of these folks live in rural parts of our state. It's a smart investment in them, and it's critical for our economic development. That's why such a broad coalition of people came together to support expansion, from chambers of commerce, county governments, law enforcement, and faith leaders all across North Carolina. With our very high rates of provider participation in Medicaid, people are getting the care they need. In the first few months of expansion, the most common prescriptions filled among the millions that were dispensed were for chronic diseases, including asthma inhalers, blood pressure medication, and diabetes. It reminds us that many of these individuals were previously forced to choose between paying out of pocket for these critical medications or simply going without. Recognizing the shared opportunity to improve health, North Carolina's approach financed the non-federal share of expansion with costs with an assessment on hospitals and health plans. These providers, with longstanding commitments to their communities through their services, charity care, and other public benefits, contributed to make health within reach in their communities. While increasing access, we've ensured that our Medicaid program is driving towards prevention. In 2018, North Carolina was approved by the Centers for Medicaid and Medicare to pilot a first-in-the-nation program allowing Medicaid to cover non-medical drivers of health, such as food, transportation, and housing. North Carolina's Healthy Opportunities pilot launched in April of 2022 in 3 of our most rural regions of the state. And after only 2 years, we've had an independent evaluation recently published in the Journal of American Medical Association that shows that pilot participants now getting the food and other supports that they need are less likely ending up in the emergency department and the hospital. And even with the costs of these investments in their food and transportation, we're finding that we're having a total net savings of $1,000 per person per year. This is a windfall when it comes to insurance and a savings to the state, and a huge opportunity as we scale this program. The Medicaid program is ensuring access to care. In the decade leading up to expansion, North Carolina saw nearly a dozen rural hospitals shuttered. These providers, like any other business, simply can't afford to stay open when 30 to 40% of the people coming through the front door have no way to pay. Expansion and our state-directed payment program allows for these facilities to be stabilized. Likewise, with Medicaid expansion, North Carolina was finally able to close the gaps for individuals fighting for their lives against the opioid epidemic or struggling with chronic mental illness. During the pandemic, Congress passed laws that allowed for North Carolina to get an incentive FMAP payment. Those dollars went for us to scale $835 billion investment into behavioral health. Medicaid is a unique insurer in that it covers critical long-term care services and supports for older individuals and individuals with disabilities. Nationally, a quarter of Medicaid expenditures will go towards these types of services: nursing home, in-home care supports, and more. Thousands of North Carolina seniors that may have had private insurance throughout their entire lives now rely on Medicaid to cover their nursing home care after they have exhausted their personal resources. Meanwhile, younger individuals with disabilities and their families rely on the Medicaid program for care that simply isn't covered by any other insurer. And because of their need for round-the-clock care, their cost per person can be quite high. Any rationing of this care for them and their families would be disruptive, if not deadly. In North Carolina, I strongly believe that we've made a roadmap for reducing costs, improving health, and simplifying the healthcare system for families. And of course, there are even more things we can do. Let's build on our prevention gains by integrating SNAP, WIC, and Medicaid to invest in food. Let's create real efficiencies by improving how eligibility systems work so that people aren't tangled up in a web of nonsense and states don't have to spend as much time building technology. But let's be clear. Any dollar just ripped out of the system will jeopardize the promising path that we are on, and it will jeopardize the health of millions. In North Carolina, we want healthier families. We want more money in their pockets, and we want their peace of mind that when illness strikes, all will not be lost. Medicaid makes that possible every day. Thank you.
Thank you, Secretary Kinsley, for your leadership and your testimony today. I want to focus my questions on two broader impacts of these Medicaid cuts. If Republicans succeed in imposing a nearly $1 trillion cut to Medicaid, can you help us understand what will that mean for state budgets like your own, and what options will states have, like North Carolina, for absorbing that large of a cut?
Well, unfortunately, there won't be many options. Medicaid brings at least $28 billion into the state of North Carolina. Our portion of that is a third. Any cut is going to create billions of dollars of a gap that the state of North Carolina, and I would imagine pretty much every other state, simply can't cover. And it's important to remember that 98% of every dollar that comes into North Carolina for Medicaid goes to services and providers. There's no wiggle room here to pull dollars out without people experiencing the harm immediately.
I share your concern, Secretary Kinsley, as I know we all do, and I wonder if you might expound upon that in greater detail. So who might lose benefits? What kind of services may ultimately be curtailed?
Well, first and foremost, I think of our seniors. Many individuals forget that, as they exhaust their personal resources, Medicaid is the only program in the country that will cover skilled nursing facilities for these individuals. When we think about the chronic disease burden in our communities, many folks will end up in that need. We know that major providers that provide nursing home care rely pretty much exclusively on Medicaid as one of their primary sources. And so pulling dollars out of the Medicaid program will negatively impact those seniors. I also think in North Carolina that 50% of births are covered by Medicaid. When we think about the importance of a healthy start to life.
Can you just repeat that, Secretary Kinsley?
1 out of 2.
1 out of 2, 50%.
Are covered by Medicaid. And so making sure that those babies are born healthy with the strongest start in life. In North Carolina, again, thanks to Congress, took advantage of extending postpartum coverage for women. So that way those women could also be healthy. We know healthy families lead to healthy children, and it's a smart investment.
Thank you. I'll start over really quickly. Thank you for being here. I'm a pulmonary and critical care doctor, and that's my background. For 17 years, I took care of patients in Oregon at the most critical times, their greatest need. It's their stories that I carry with me, as I know you do, in this advocacy. It is imperative that we understand the impact these Medicaid cuts that Republicans are leveraging will have on people, our states, as you just mentioned, and our healthcare systems, including our hospitals. So can you please explain what these Republican Medicaid cuts will do to hospitals and also our children's hospitals?
Absolutely. Thank you. So, as I mentioned earlier, North Carolina has had nearly a dozen hospitals close in rural parts of our state in the decade leading up to expansion. And that makes sense. You know, we have a disproportionate number of people living in rural communities that had historically been uninsured. Medicaid expansion changed that. Expansion made possible for those folks to get covered. And now Medicaid, 25% of our Medicaid enrollees live in rural North Carolina. It's just simple math. If people walk through the front door of any business, they don't have a way to pay. And what businesses do in these hospitals in rural North Carolina is they start to jack up the prices of everybody else, whether you're on private insurance or private pay. But eventually that's unsustainable, and then they also just have to choose to shutter. It also leads to more consolidation in the health system, which also drives up prices. Medicaid expansion keeps these hospitals open. Medicaid broadly keeps these hospitals open, and it also gives the foundation for more competition in our healthcare system that can help drive down costs overall.
Thank you. And it's clear that far too many people in our country and in my district struggle with mental health challenges and addiction. Portland has clearly been in the news for that. What will Republican Medicaid cuts mean for access to affordable mental health and addiction treatment?
I came home to North Carolina in 2018 with the passion to make a difference on behavioral health in North Carolina. We were fighting the opioid epidemic. We brought coalitions of people together, and we heard over and over and over again from sheriffs saying we are not going to arrest our way out of this problem. We need different tools to make a difference. And I will say it was a lot of that energy that brought together the coalition of sheriffs and law enforcement that said we need Medicaid expansion. The people who are getting stuck in the gap, who are rotating through jails and prison, when 60% of people in incarcerated settings have a substance use disorder, when they're rotating through, we need a different tool that looks like pre-arrest diversion, Medicaid-assisted treatment, reentry supports. You know, if you don't have a way to pay for these services, then people get stuck in these cycles. And in the end, that cost is borne by our law enforcement. That cost is borne by our local communities. You know, nothing is free. We just need to put the money in the place where it makes a difference, and Medicaid makes possible for us to invest in prevention and to lower costs, save lives, and get productive taxpayers into the community.
I agree completely. Thank you very much.
Thank you, Secretary Kinsley, and especially for your focus that you've raised about rural hospitals. Medicaid is a lifeline for so many that I represent in my beautiful rural district in New Mexico. And you mentioned the impact of Medicaid cuts on hospitals. I want to focus a little bit more on the impact on rural hospitals. More than 700 rural hospitals, 1/3 of all rural hospitals, not just in your state, but across the country, on the brink of closing. And many, and maybe most of those are in Republican districts. For example, in Representative Marion Miller-Meek's district, Blessing Health and its 49-bed hospital closed in 22. In Rob Bresnahan's district, Commonwealth and Geisinger Health Systems get between 15 and 18% of their revenue from Medicaid. Can you elaborate a bit more on why Medicaid is so important for rural hospitals and what the impact will be with the proposed Republican Medicaid cuts?
Medicaid is vital to our rural hospitals for really two driving reasons. One, people coming in the door have a way to pay, which we've talked about. Also, when individuals have access to preventative care, then they don't end up in the hospital, and they're going to have lower cost access to this. And so hospitals are not burdened with just constant input into their emergency departments, which make these hospitals function better. But second, the Medicaid program operates something called the State-Directed Payments Program. This program allows us to shore up, at the state's direction, care within our hospitals to ensure that there's an adequate system. Across the country, this program invested about $110 billion in hospitals last year in 2024. North Carolina was about $6.5 billion. Those cash infusions and investments into these rural hospitals and hospitals throughout the state ensure that there's a hospital system for everybody, not just Medicaid patients. And I think that's an important thing for everyone to remember, is that this is really the backbone, not just for Medicaid patients.
Thank you. I'm also chair of the Democratic Women's Caucus, and as you pointed out, maternal health care is really important. Medicaid is crucial. 50% in your state, 75% in New Mexico, and 40% of all births in the country. Can you explain more about how the potential Medicaid cuts will harm expectant mothers and their beautiful babies?
Well, it's so important for a healthy start to life for us to have healthy moms and healthy babies. Medicaid expansion, postpartum coverage, and Medicaid broadly is the recipe that makes that possible. Medicaid expansion allows us to try to connect with mothers to get them engaged in care sooner. North Carolina, Black mothers will die 2.5 times as often as white mothers in poor maternal health outcomes. Medicaid expansion is a game changer for us to close that longstanding health disparity, to try to get people engaged and to get them engaged in good services like doula services and collaborative care models that we know make a real difference for these mothers and help give them a strong start to life. And then, of course, actually covering the birth. It's tragic for me to imagine the choices that mothers and young families will have to face if they have no way to have their baby be cared for and to have their pregnancy be cared for. They're going to skip critical services in advance of that birth that are going to result in really poor health outcomes for everybody. This is a really important investment, and pulling dollars out of the Medicaid system will make a really negative impact on these young families.
On behalf of the mamas and the bebés, thank you.
Well, thank you, Secretary Kinsley. Your leadership and that of Governor Roy Cooper, as well as our Republican legislature, made North Carolina the 40th state in the country to expand Medicaid in 2023. This was after more than a decade of political gridlock. You oversaw a seamless, efficient implementation that put life-saving health care within the reach of more than 600,000 North Carolinians. I'm proud to call you my friend and my neighbor. Across the country, more than 72 million Americans rely on Medicaid. There are family members, our friends, our neighbors, our coworkers, and they all count on Medicaid to keep them healthy and take care of them if they get sick. House Democrats are fighting to save Medicaid for people across America. And fighting for you means listening to you. We asked you to share your stories about Medicaid with us, and we heard from thousands of everyday people across our country who count on Medicaid for the care they need. Here are some of their stories.
Because we all need care, and our families, my mother, deserves to be treated with dignity and get the care they need.
I have a 25-year-old son, Jonathan, who does not walk, talk, or see.
Many people who need long-term care require Medicaid dollars to pay for it.
Medicaid is a lifeline for many, many people, including people with disabilities.
Without Medicaid, our kids' health care could have caused a financial crisis for our family.
These out-of-pocket costs would not have been affordable for a family of 9 on a very tight budget.
I desperately am reliant on Social Security and Medicaid for my own life.
Cuts to Medicaid puts my life in jeopardy.
Really what it comes down to is basic human decency and the respect of all our citizens, no matter what their needs are.
I plead with you.
Medicaid means everything to our family.
Because this program is essential.
So please don't cut Medicaid.
Please stand against these cuts for my children and for all of our children.
For my family,
for my son.
For Medicaid.
Families like mine are counting on lawmakers to protect Medicaid. Can I count on you?
As we just saw, people from all walks of life and in every corner of this country rely on Medicaid to get the care they and their loved ones need. This includes long-term care. Across the nation, Medicaid is the primary payer for long-term services and supports, the largest payer, period. Millions of seniors and individuals with disabilities rely on Medicaid to live happy, fulfilling, and dignified lives. And as people age, more than half of Americans will need at least some level of long-term care. Beyond improving the quality of life for patients themselves, caregiving is the foundation of our economy, and it makes all other work possible. When you're not worried about those that you love, that they're okay, you can do your work. Medicaid is essential for caregiving in America. For many people, it is the difference between being able to make ends meet and falling into financial ruin, total chaos, total mental, what am I going to do? Without Medicaid, far too many families would have their lives upended. Families like the Dunhams from Feasterville, Pennsylvania. Chris Dunham is a full-time caregiver for his son, Will, who is sitting behind him, and alongside Mr. Chris's wife, and Will's mom, Maggie. Chris, thank you for your willingness to share your family story and for being here today. Please share it with us this morning.
Sure. Good morning. My name is Chris Dunham, and I am a full-time caregiver for my 16-year-old son, Will, who has complex medical needs. Will's here with me today, as is his mom, my wife, Maggie. We traveled from Feasterville, just north of Philadelphia, because we're gravely concerned about what drastic cuts to Medicaid would mean for Will. And thank you for the chance to share our story. 1 month after Will was born, I just need water. We noticed problems with his vision. What followed was an extremely difficult few years. With Will battling seizures, struggling to sleep, and missing milestones. At age 5, he was finally diagnosed with FOXG1 syndrome, a rare genetic disorder that causes global developmental delays, neurological problems, and other health issues. Children with FOXG1, lovingly called foxes, need round-the-clock care. The syndrome has a range of severity, and Will falls in the middle. His first symptom was cortical visual impairment, followed shortly by cataracts. He doesn't communicate verbally, uses a wheelchair. Surgically, he's had a feeding tube placed, his cataracts removed, and rods implanted in his back to help correct scoliosis. Therapies have helped immensely, most notably with vision. We suspect his range of vision was less than a foot at birth, but therapy improved it to around 20. Offering him a presumably better future. He's a blessedly happy boy, smiling and laughing throughout his day. Common for most foxes, he loves water, music, as well as balloons, travel, and his bed friends. When he was a baby, I left my career as a librarian to care for him full-time, while Maggie continues to work in healthcare. After one too many hurricanes, my parents recently moved in with us from Florida, and we anticipate that as they get older, they'll need care too. Like many Americans, our household is a delicate balance of juggling schedules, caregiving needs, and finances. I recently qualified for a stipend as a live-in caregiver through Medicaid. That's made an enormous difference and has enabled us to get mostly out of debt with the exception of our mortgage. We're not wealthy, we're just trying to make it day to day. Medicaid is nothing short of a lifeline for us. With Republicans proposing to slash hundreds of billions of dollars from Medicaid, all to pay for tax cuts for billionaires, our future is now uncertain. These cuts would have devastating consequences for our family. It's also heartbreaking because I've been hopeful that our country was moving forward in recognizing the need to invest in the care economy. The care economy saves lives. Please protect it. This starts with paying caregivers what they deserve. I have 2 herniated discs from lifting wheel because for the past few years we've only had aides 3 evenings per week due to a lack of available staff. Slashing Medicaid would send us in the wrong direction. We must stop these cuts. My wife and I are not young, and as we get older, we know we won't be able to care for Will forever. We need Medicaid. As a father, I'm grateful for everything you do to protect Medicaid. No, that was water. Our nation's families, communities, and economy depend on it. Thank you again.
Thanks for sharing your story with us today. We really appreciate it. As you told us, Medicaid is essential for your son Will and so many other young people across the country to get the care they need. In fact, Medicaid was designed with kids in mind. It provides affordable health care for kids whose parents work but don't make a lot of money, and for kids with special health needs like Will. Across the country, 37 million kids relied on Medicaid last year. That's nearly half the kids in the entire country. And data has shown that kids covered by Medicaid have better health outcomes and greater success in careers and life than kids who grow up uninsured. Medicaid covers kids like Christina Otero's 8-year-old nephew, William. Christina works in the healthcare industry in Western New York and is William's legal guardian. Christina and William count on Medicaid as they navigate the healthcare system, and Christina is with us today to share her story. Thank you so much, Christina. You are now recognized.
Good morning, and thank you. William's not here with us, but he's with us in heart. He's back home, but I figured I'd send you or give you a picture to look at. So good morning. Like she said, my name is Christina Otero. My family and I live in Western New York, and I've worked in healthcare a little over 20 years. And I've been a productive member of society for as long as I was old enough to vote. Thomas Fuller once said that health is not valued until sickness comes, and he who has health has hope. Healthcare is a necessity no matter your economic background. So today I'm here to share my family's story and to stress the critical importance of Medicaid for millions of Americans. In New York alone, nearly 7 million people rely on Medicaid for their primary health insurance coverage. The child poverty in New York is among the highest in the country, and in Buffalo, nearly half the children live in poverty. Our hospitals, nursing homes, and home care agencies rely on Medicaid reimbursements to provide critical care and services to your constituents in our communities. My sister-in-law was a state correctional officer who sustained a life-altering injury while on duty. She later passed from those complications of her injuries, which is why I now have custody of 2 of my nephews, William, the youngest, that's 8, and Charlie, that's 10. Sadly, William was born with several complications. He's autistic, nonverbal, and was diagnosed with cerebral palsy and hydrocephalus. He also has a shunt implant. Now, that shunt aids draining excess fluid from his brain. So William naturally requires a team of multiple therapists and doctors. He sees a neurologist, a neurosurgeon, he sees an orthopedic specialist, as well as receiving speech, physical, and occupational therapy. These therapies are crucial for individuals or children like William with cerebral palsy. Services provided by these specialists play a vital role in managing impairments and improving his mobility, assisting with activities of daily living, and all while providing a sense of hope in maximizing his independence and enhancing his quality of life. William also receives applied behavior analysis, also known as ABA therapy. This therapy uses behaviorisms to help William learn new skills that improve his communication, social interactions, independence, and reinforces positive behaviors. William also sees a speech-language pathologist, I think I need one too, aiding with his communication disorder. These services are generally required every single day. With all of his medical providers, the amount of co-pays through a private or commercial insurance would be unaffordable. Fortunately, William is eligible for Medicaid, and it's been a lifeline for William since his birth. just like millions of children with disabilities. Our hospitals and nursing homes depend on Medicaid reimbursement to provide critical programs and services to kids like William. Medicaid is one source of payment for safety net hospitals. In Buffalo, we have Oshai's Children's Hospital, and now closed rural Eastern Niagara Hospital. Now, can you imagine if Medicaid is cut $880 billion? Babies and children will die without access to health care, and this is a fact. Our frail and elderly will die without access to health care. Now, nearly after 100 years of serving our Buffalo community, our Weinberg campus, which is one of the last nonprofit nursing homes in our area, was forced to close its doors after years of low Medicaid reimbursement rates. The abrupt closure forced residents and their families into other for-profit facilities. Now, can you imagine your loved ones having nowhere to go for health care because our government wants to cut services only to provide breaks for billionaires? In many neighborhoods across the state of New York, hospitals and nursing homes are closing. If facilities in rural areas are closed, no one will have access to health care, even those with private and commercial insurance. Dr. Paul Farmer once said, "If access to health care is considered a human right, who is considered human enough to have that? Is William, my nephew, human enough to have that right? Please don't cut Medicaid." Access to Medicaid coverage is essential for people in our community to live and thrive. Thank you.
Thank you, Christina, so much for your advocacy for William and for all Americans' health care. As one of the only nurses in Congress and a former career federal worker who worked to implement the Affordable Care Act, I know firsthand how critical Medicaid is for the working families in our communities. Like me, our next witness is also a registered nurse. Nancy Higgins works in the intensive care unit at Maimonides Medical Center in Brooklyn, New York. For a safety net hospital such as Maimonides and hundreds more like it across the country, Medicaid is the difference between serving patients and shutting down, denying communities the health care that a high-quality hospital provides. Nancy understands these challenges firsthand because she also advocates for patients and her fellow nurses as the president of the New York State Nurses Association and National Nurses United. We are so grateful that Nancy's joined us to share her unique perspective of Medicaid today. Nancy, you're recognized.
Thank you. And thank you, Leader Jeffries and the Steering Committee on Policy for giving me the opportunity to take this part in this conversation today. My name is Nancy Higgins. I have been a nurse for over 30 years, and I'm also the president of National Nurses United, the largest union and professional association of registered nurses in the country. The current administration, along with House and Senate Republicans, have proposed massive funding cuts to the Medicaid program. As a nurse, I have a deep understanding of the devastating impact these cuts will have on our patients, our nurses, and healthcare facilities where we all work. I work as a nurse at a safety net hospital in Brooklyn, New York, and a large number of our patients rely on Medicaid for their health care. Medicaid is a life-saving program. It has helped so many of my patients get the preventive care that keeps them healthy and receive medication and treatment when they are ill. Medicaids ensure that millions of women receive prenatal, maternal, and postpartum care, and that their babies and children have health care. Millions of people with disabilities and seniors rely on Medicaid to provide long-term services and supports. Because of Medicaid, our patients get health care coverage that otherwise they would not have. More than 72 million, or I would say 1 in 5 people, receive health care coverage through Medicaid. Additionally, 4 out of 10 children, 4 out of 10 seniors depends on Medicaid. Everyone in this room certainly knows someone who relies on Medicaid. Receiving quality care is fundamental to the economic stability of families and communities. People who are enrolled in Medicaid are much likely to maintain stable work environment because they are able to get the health care that they need. Cutting Medicaid will be catastrophic. If these funding cuts happen, people will die. And I'm saying it again. If these cuts happen, people will die. Hospital, like the one I work, will see a higher rates of uninsured patients and an uncompensated care. This will put safety net hospitals like mine at a financial risk. This could no doubt lead to hospitals shutting down critical units or services, or a hospital even closing entirely. For people who can remain enrolled in Medicaid, they will likely have harder time finding a provider that accepts Medicaid and will experience delays in care. Rural hospitals are already fighting to keep their doors open, and without the support of Medicaid's fund, it will be even harder for them to continue to provide care. We all have an important role to play to stop these cuts from happening. Everyone here today needs to make sure that people understand what cuts to Medicaid will mean to the future of healthcare. If we don't, communities could lose their hospitals and healthcare centers. Millions of people could be unenrolled from their healthcare plan. And nurses and healthcare workers will lose their jobs. Nurses, like myself, will not sit back and let this happen. We are committed to protecting the health of our communities and urge every member of Congress to oppose any cuts to Medicaid program. And once again, thank you for inviting me here today.
Thank you, Chris, Christina, and Nancy, for sharing your powerful stories. After hearing your stories, it seems impossible to justify cutting Medicaid. So why are Republicans doing it? Let's take a look.
House Republicans say they need to cut Medicaid to balance the budget, but that's not their real agenda. They're taking our medical coverage away from us to pay for another private jet for their rich friends. If we don't stop House Republicans from cutting Medicaid, the wealthiest Americans get a massive tax break while our health suffers. That's why we need to save Medicaid and protect Americans.
I think we can all agree that the Republican plan to cut Medicaid to give tax breaks to super wealthy is both sick and shameful. So we just heard 3 very powerful stories. I have a question for the witnesses, and I'm going to start first with Nancy. What percentage of the patients at your hospital are covered by Medicaid, and is that typical of safety net hospitals across America?
The hospital I work at in Brooklyn is called the New York District 11. Over 254,000 people enroll in Medicaid, or we call it CHIP in District 11 alone. That's 34% of the population. As a safety net facility, we serve a large number of patients on Medicaid. This also means that majority of our funding comes from Medicaid, about 75%. Safety net hospital rely on hospital Medicaid funding. The hospital where I currently work at has the highest maternal birth in the state every year. We also provide level 1 trauma center for pediatric patients as well as adults. We have an open heart program where we perform major open heart surgery and you name it, from everywhere else. If we were to cut the Medicaid funding, then our patients, I don't know where they would go for their life-saving care. So that's why we're here to say this is not going to happen, and we cannot let it happen, because more than 75% of our patients rely on Medicaid.
Thank you, Nancy. My next question goes to Christina. And clearly the impact of Medicaid cuts go beyond just hospital systems. They affect individual lives. Can you tell us how Medicaid has helped William to grow through both occupation, physical, and speech therapy?
Absolutely. So in a little less than 2 years, William has shown a significant improvement with motor strength. He now has over 60% use of his left arm. When he first came to me, his arm was stiffed due to his disability. It was more frozen. He's no longer restrained to a chair. He's actually walking with the assistance of an AFO brace. He's communicating via signing and using a picture book. He's saying roughly 5 to 6 words when he said none. He's eating independently with utensils, which he didn't before. We had to feed him. He signals to us when he needs to use the potty, and he's learning how to undress himself, and he follows simple commands like get your shoes, let's go to the bathroom, and he has recently started to engage and play with his peers and family members. So ultimately, Medicaid has helped make all of this happen by paying for those services.
Thank you, Christina.
So first, thank you, Chris, for being here today with Maggie and Will. Your love and strength is inspiring. I'm wondering if you can talk a little bit more about what you think you'd have to do differently if for your family if you lost Medicaid.
Sure. I think that we'd get by as best we could for a while, but at some point we'd probably have to sell our house and move to somewhere smaller. And then as things progressed even further, because of the massive amounts of things that are covered for him, like all of his food, since he's tube-fed, that eventually he'd probably have to be institutionalized, or the state would have to take care of him.
Well, I don't think that your story is alone. The reality is that these impacts ripple across our entire healthcare system. Nancy, could you explain what might happen if a large number of your patients lost Medicaid coverage and continued to need care?
Well, they would mean they would, I don't know what would happen to them, then they would not survive. And what we do, we always treat our patient that enters our hospital no matter what. If our patient are kicked off Medicaid coverage, that means they would see a huge rise in uncompensated care. Safety net hospital really rely, their financial to survive. So a cut would really close our hospital and put our hospital in financial trouble. As it is right now, most of safety net hospitals are in life support. So it's like a day-to-day how to see our patients, because a patient comes in as a nurse, my priority is care for them and make sure that they go home and able to do, because I've been a critical care nurse for over 30 years. And as a parent, as a person who grew up in a family of 10, when someone come in because of lack of care, then that brings them really back to start with. Because if you have primary care, you have your Medicaid, you're able to go to the clinic to seek for care, then you would not need critical care as possible. So if we close our door, we're not able to provide the reproductive that we're doing for our patients right now because we have the highest birth. We're not able to perform open heart surgery on patients who could not afford to pay out of pocket that rely on Medicaid. We're not able to, insert a shunt in a young child's brain because we have a great neurosurgery program as well. We're not able to help a child with a scoliosis to go to the orthopedic program. We would not be able to care for anyone in our communities. And I hate to be blunt, that we would lose so many patients. We would lose our communities. And how do we treat infants, children that are born? We're supposed to look at a future and make sure that they continue to grow in a healthy environment. So without medical coverage, you can't do it. If you have a large family, then you have to make a decision. You have $50. That $50 you need to go to see a physician. But you could use that $50 to go grocery shopping and care for your family. So you have to make that decision. And I'm speaking from someone who grew up in a family of 10. Decisions have to be made.
Impossible choices. Thank you.
This is on. Mr. Dunham, thank you so much for coming today, and thank you, of course, to your beautiful wife, Maggie, and your beautiful son, Will, for your bravery in coming forward today. I know you touched on your testimony about how you were a public librarian, and Medicaid support for caregiving allowed you to stay home with Will and be his primary caregiver. And that compensation for caregiving is what allowed that to happen. If those cuts to Medicaid went through and you lost the compensation for caregiving, how would that affect your family's financial security?
It would affect it greatly. Initially, without this compensation, because it's only been the past few months that I've had that. So I've been 15 years of volunteering to care for him. But Maggie had a part-time job until the pandemic hit, over and above her full-time work. So she would likely have to look for a second job again, and I would go back to volunteering. Whether or not we would still be able to have aides to come help as he gets heavier is unknown. I don't know how that funding would come through.
Thank you. Thank you, Mr. Dunham. And Ms. Otero, I want to close with William. You've done such a beautiful job bringing him into this room today, and really your care for him is such a calling and such a beautiful testament to your heart and your life. Can you talk to us more about how 8-year-old William would get care without Medicaid if these cuts went through, and how you think that might impact his development?
Right. So my first hunt would have to most likely try to find a health plan that would even accept, if any, his pre-existing conditions. We all know how that would go. And like Mr. Dunham mentioned, financially, it would be ruined. I already work 2 jobs and juggle William's care, but most likely need a third. And I would have to most likely slash half his services, meaning that William would regress. William would most likely lose or have more complications, muscle contractions, increased risks for falls and injury, social isolation, and reduced communication abilities, because if he doesn't have a speech therapist to help him speak or communicate, right? And so much more can potentially impact William. Not to mention, like Mr. Dunham mentioned as well, if I'm not able to care for William or my family can't, I would have to surrender him to the state. And is the state going to love William and care for him the way we do? No. And the worst case scenario, without services, essentially he can die.
Thank you. Thank you both. And you both as caregivers, it's important to note that it's not just what is best for your families, but keeping your children out of state care is what is best for everybody. It's best for them to be around their loved ones. It's best for you to stay together as a family. It's best for everybody that in every aspect, it's best for our communities as well. So thank you.
Thank you, Chris, Christina, and Nancy, for sharing your stories. As Democrats, we've always stood squarely on the side of families like yours. And at the heart of that commitment is protecting fair health care. Nearly 1 in 3 Americans count on Medicaid for essential care, whether it's visiting their doctor, accessing long-term care as they age, or ensuring their newborns receive the healthy start they deserve. Despite this, House Republicans just voted for a budget that calls for the largest cuts to Medicaid in American history, all to help pay for yet another round of tax cuts for billionaires. Now, Republicans will tell you their plan won't touch Medicaid, but let's be clear, that's simply not possible. You can't cut $880 billion from the Energy and Commerce Committee's jurisdiction, where more than 97% of the spending is for Medicare and Medicaid, and pretend the program remains unaffected. So to set the record straight, we turn to the nonpartisan Congressional Budget Office. Their analysis is unequivocal. Cutting $880 billion from programs under Energy and Commerce's jurisdiction would force devastating reductions to Medicaid. The choice Republicans are making is as shameful as it is clear. They're willing to rip health care away from millions of Americans just to reward their billionaire donors. It is a betrayal of the middle class. It is a betrayal of the very people we were sent here to represent. It's putting their wealth over your health. Now let's take a look.
They need to cut Medicaid to balance the budget. But here's who they're really cutting for. They're for the richest traders on Wall Street, helping them save $250,000 on taxes every year. For oil barons to save $5.6 million when passing their billion-dollar businesses onto their heirs. For real estate tycoons who earn $10 million in dividends, an extra $750,000 tax savings. They're cutting our health for their wealth. That's why we need to save Medicaid and protect Americans.
As we close out the hearing today, I want to start by thanking our witnesses for being here today. Today's hearing has been eye-opening, and it serves to remind the American people that just like Social Security and Medicare, Medicaid is an essential program that tens of millions of Americans count on. Americans of all ages, Americans of all races, Americans in every part of our country, Americans like Chris, Christina, Nancy, and children like Will and William. And make no mistake, no matter what Donald Trump, Mike Johnson, or any Republican says, Republicans are trying to cut nearly $1 trillion from Medicaid. The Republican plan to cut Medicaid is heartless, and it's self-serving. It steals from people who are struggling to get by to give multi-million-dollar tax breaks to people who fly on private jets. Hardworking American taxpayers, the middle class, and people who are struggling to make it into the middle class cannot afford to have their health care taken away. And they certainly don't deserve to lose the health care they need so that billionaires like Elon Musk get another tax break. House Democrats are standing up for everyday Americans. We will never give up, working day in and day out to save Medicaid and protect Americans' health care. This hearing stands adjourned, and the fight goes on for House Democrats.